Repairing patients who previously had Intacs surgery. Intacs are for lack of a better word, a plastic piece that is placed into the cornea to help try to alleviate bowing forward, like in a keratoconic cornea or in a LASIK-induced ectasia cornea or something. They were used years ago to actually help with myopia as well, but really they have become used for these kinds of ectasia procedures today. The problem is that they are a non-specific device. In other words, you're pushing down on an area hoping to get a better shape. And what they can do is get in the way of repairing or even getting a scan of the cornea because that plastic piece is there. So a lot of times we have to take them out. And when you take them out, you can actually get the cornea sort of springs back to where it was pretty quickly, but they do get in the way.